Let's stick with the coronavirus and all of the latest developments coming out with the new study out of Oxford University, as well as, of course, we spoke with the Regeneron's co-founder and chief scientific officer yesterday about that antibody cocktail that could be very promising. For more on that, Dr. Leana Wen, an emergency physician and visiting professor at GW University School of Public Health, joins us to discuss. So Leana, when you look at the news out this morning out of that study, I saw that you took to Twitter to kind of applaud that this could be a move in the right direction to use a very cheap steroid to treat some severely infected patients. But there seem to be some warning signs, right? There's a big caveat here. Can you explain and kind of flesh out what that looks like?
Yeah, absolutely, Melody. There is a lot of promise with dexamethasone, which is a commonly available steroid that is a generic that's been around for 40, 50 years. There was a study done that showed that dexamethasone use in severely ill COVID patients reduced their mortality rate, increased the likelihood of survival for patients who are, again, very ill, either on oxygen or on ventilators. So that's amazing if this is the case, because remdesivir, as we know, has some benefit. That's the antiviral medication, but remdesivir is very expensive. Remdesivir also will run out of supplies of that medication. But if in fact this cheap, widely available medication has this effect, that would be great. But this study is not yet peer reviewed. And I do think it's important for us to keep that in mind, especially because there have been a number of studies that have been retracted, given how quickly information is coming out about COVID-19. And also the study was of very ill patients. So I do not want anyone to go out there right now and buy dexamethasone for their own use. This was not studied for prevention of COVID-19. And of course, we know that there are significant side effects of any medication when one uses them inappropriately.
And Dr. Wen, I think that begs the question, as I've seen and heard from a lot of doctors over the last couple of weeks, to kind of trust the sources you're listening to. And one of them is supposed to be the FDA, right? And the FDA approval of any sort of drug or food is supposed to give you a sense of confidence. But as we saw that reversal in that decision with chloroquine and hydroxychloroquine yesterday from the FDA, what is your overall take on just how the conversation is developing? As we know, University of Oxford is probably getting a lot of good press right now, right? It could be a great marketing tool for them. Do you have some skepticism around perhaps people jumping the gun a little bit before publishing their results?
I think one challenge right now with COVID-19 is everybody wants to have hope. We all want to be optimistic, and also we really need to act on any information that comes out, right? If there is scientific research that in fact shows substantial benefit of a new medication, everybody wants to have that data so that we can begin using this medication. And so we have to weigh that, though, against the safeguards that are in place when we do clinical trials. I mean, clinical trials have these safeguards for a reason. There's a process for a reason, because we don't want to create false hope, and we also don't want to have the side effects outweigh the benefits of using a medication. And so again, for something like this, where we haven't seen the full results, where the results are not peer reviewed, where they're not yet validated, it's important that we know, but also important that we wait for these validations to come through before we totally change our clinical practice.
We've seen these projections and forecasts in regards to the number of potential total deaths from coronavirus kind of ebb and flow over the last couple of months. But a new Institute for Health Metrics and Evaluation forecast does project 201,129 deaths in the United States through the beginning of October. Can you give us a sense of whether that's kind of in line with what you're hearing from your peer set and your research?
Well, if we look at the number of deaths that's already been happening, and we're talking about somewhere between 600 and 1,000 deaths a day, if we just multiply that out until October, we'll get more than 200,000 deaths. And I know this is a really grim number, but I would say it's not surprising, number one. And number two, that we should not treat it as being inevitable, because models are based on people's behavior. It's not static like a weather forecast. You're not going to be able to stop a hurricane, but you can stop infections and you can prevent deaths by all of us taking steps today. So yes, hospitals should be getting ready for a surge in the number of cases, But individuals, for example, we know that being outdoors is better than being indoors. We can reduce the rate of transmission by 19 times by doing that. Wearing masks, you can also reduce your risk of transmission if we all wear masks by at least 50%. We should keep that physical distancing as much as we can. Just because we can now do something doesn't mean that we should. So even if your state has already reopened and you now can visit a restaurant, doesn't mean that you should. It certainly doesn't mean that you should stay in an indoor crowded bar with a lot of people. Just because you have to go back to work doesn't mean that you also have to go to the gym and get your haircut. And so I think the actions that we take now will not only protect ourselves, but it will also reduce the rate of transmission in our communities and protect all of us as a country.
And Dr. Wen, I mean, you sound so reasonable. I really like all of those suggestions because they're very tangible, right? And it shows that we have control over our actions. Unfortunately, I do think with the reopening of certain states and a lot of this pent up energy that people are clearly trying to use, whether it's the gym or the hair salon and whatnot, I feel like it's the Pandora's box to a certain extent. And in my mind, we're still very much part of the first wave. We're not even thinking about, okay, is this a second wave or not? We're still in the thick of it. So how do you really convince Americans in particular who are so used to this idea of liberty and wanting to kind of exercise their freedoms during this period of time to take that to heart, especially for some folks who may not have anyone in their circles who actually do have coronavirus?
Yeah, that's key. I think for folks in the New York City area, many people have had some experience with it because of family members, loved ones who may have died from coronavirus. And that certainly shapes people's perceptions. But there are some communities that have yet to be hit by COVID-19, and therefore they don't know how severe the effects are. And even if you recover, how you continue to suffer some of these effects as well. So I do think it's important for all of us to talk about and acknowledge quarantine fatigue, that we have been doing a lot and sacrificing a lot to shelter in place and be at home. Well, now we have reopened, but we now need to proceed cautiously. And I think that's the key. It's not to say, don't go out and live like hermits forever, but rather, if you are going to go out and see your friends, try to see them in an outdoor place where you can stay 6 feet apart. If you can't, wear a mask, but know that masks do not replace social distancing. If you're going to go out to a restaurant, takeout is safer, and then still being outside doing dining is safer than being inside doing dining. If you're going to see your loved ones, better to still wave instead of hugging and shaking hands for the time being. I think these are all these strategies we can take so that we get back to some semblance of normal and we're able to resume our lives while still reducing the risk of virus transmission as much as possible.
And Dr. Wen, quickly, speaking of loved ones, we did see some new reporting that coronavirus deaths in U.S. nursing homes topped 50,000 cases. And then you think of some new reporting out of prisons as well. As states have started to reopen, those kind of two hubs have really been spreading the disease quite quickly. When you think about the long-term effects here and what the future of a nursing home would look like, what comes to mind?
Well, I think right now what comes to mind is that we need much better surveillance. We really, now that we know that congregate living facilities like nursing homes, prisons, homeless shelters, et cetera, are where you have all these outbreaks occurring. And when you have one disease that's caught, almost certainly that's the canary in the coal mine, that there are many other diseases, many other people who have infections that we just don't yet know about. And so we need to do a lot better with surveillance. We need to target resources to those areas that are the hardest hit. And I think in the future, we just all have to do our best to protect ourselves and the most vulnerable among us.
Hey investors, Zach Guzman here. Are you interested in learning more about the markets and getting the latest financial news? Well, then click right here to subscribe to our Yahoo Finance YouTube channel. Get the latest up-to-the-minute market analysis, big interviews in the world of finance, and information on how to manage your money every day wherever you are.